Hello friends. Immediately following this short introduction video is a video of an infant, a 2-week-old new patient exam, and the infant's first adjustment. I did this video on the request of a group of women that have a business that works on lip tie, tongue tie releases, which are essential to your baby's health and the myofascial lines that go through the whole body. And they wanted me to do a video to show how safe and effective an infant adjustment is. Why would a baby need to be adjusted, you might ask? The birth transition is traumatic and can result in misalignments of the spine and or cranium that can result in ill health and baby's inability to thrive or digest properly or move properly. And with an infant, there is no muscular tonicity. Babies are very fragile. They're very, their head lolls all over the place. You have to protect their spine. And for that reason, the amount of pressure it takes to adjust an infant is literally finger pressure. Just finger pressure, maybe a little bit of a torque with a finger. And this is done at the right time, on the right segment of the spine, in the right direction. This is why chiropractors are the best and only profession that can do this. If your medical doctor or any medical profession freaks out on you, they just are honestly ignorant and untrained in chiropractic. Chiropractors either work on infants or they don't. Chiropractors that don't work on infants will tell you right out of the gate they do not. Chiropractors that are trained, like myself, will share that. You'll notice, I'm going to tell you, this is a 6-minute plus video, and it's a little bit like watching paint dry because it barely looks like I'm doing anything. With infants, I'm doing a lot of observation. I'm moving their bodies to check their range of motion and mobility. I'm observing what their posture is. I'm feeling for muscle tension, alignment or misalignment. And when I do the adjustment, if you get that far through this video, you'll notice the baby starts crying because it's a sore spot. He's not crying because I'm racking and cracking him. I'm not doing that at all. Afterwards, now not immediately afterwards, but on the next visit, the mom said, yes, he slept well after that adjustment, which is the most common thing that happens to babies after an adjustment. When your body recognizes that there's healing to be done because the nervous system is functioning better, we heal best when we're sleeping, so babies will ordinarily sleep more deeply or sleep longer. So here we go. And remember, if your medical professional says something disparaging about chiropractors adjusting infants, it is because they are untrained. Their opinion is a personal opinion, not a professional opinion, and they should be more educated on this very safe, very effective, holistic health practice. Bye for now. Keep watching. Okay. Oh my goodness. So what you can do, let's try lay him on his back. Good. Hi. Hi, Mr. I know. Is he eating well and sleeping well?
As well as he can be. I guess his latch is not great, so it's painful. And then he sleeps better during the day than he does at night. He'll give me like 3-hour stretches during the day, but at night it's like every 2 hours.
Okay.
Yeah.
Does he get up hungry?
It's kind of, sometimes it's hungry, and then some of the time it's like he's stirring and he's awake.
Uh-huh.
And I'm like, well, I'm awake, so I might as well get up and feed you now because otherwise we're going to go back to sleep. This is going to happen again in an hour or so.
Right. How was the labor and delivery?
It was good. It went really fast.
Good for you.
Yeah.
Good. I'm so glad. He's got a misalignment right here in his lower back that I'll work on. So for let's do his range of motion. So his, let's see. I know, I'm very fascinated about something over here. Does he favor one side versus another?
Yes, originally I thought it was his right side. Now he tends to look more to the left.
Okay. But you're defying that right now, right?
Mm-hmm.
Let's see.
originally it was like he would not turn his head at all.
Okay. And a lot of times that can have to do with the tie.
Yeah.
Sometimes it's cranial misalignment.
Bless you.
Oh boy, that was a good one. So put range of motion, normal, and for cervical, and then for lumbar, he's restricted in right rotation. Muscle spasm is lumbar and cervical, and all of that should reduce as after you get the tie.
Okay.
And no edema, no tenderness so far. Check his cranial alignment. Yeah, he's a little off there. On the parietal, which is right here. Okay, yeah, and the temporal right there, which the temporal bone is, this is the T of the TMJ.
Okay.
The jaw connects to it. His subluxations, you can put the sacrum and left pelvis. C1 and upper cervical are great. Okay. Alright, so let's see. So I'm going to do an adjustment, and really the adjustment is just finger pressure.
Okay.
And did I find a sore spot? Is that a sore spot? I'm sorry. Okay, let's see. Yes. I'm sorry. There we go.
I had no idea how like tied the tongue tie was to so many other things.
It's crazy, right?
Yeah. I was like, so you're telling me he's gonna sleep better?
Yeah. It's the whole myofascial system, which goes around every muscle, every organ of the whole body. I'm sorry.
You're fine.
So you put tenderness as sacrum. And now you're just mad. Just put that in his mouth and see if that soothes him. Now I'm doing the, so for adjustments I did the PL sacrum and the left IN.
You don't do very good with our packing, but we're trying.
Oh, yeah. Oh. I know. And if he's in pain when he nurses, when he cries, it causes pain, which makes him cry.
Okay. Yeah, he seems fussier than the average newborn.
Yeah. There we go. Okay, you can lift him up. Yeah, that was his first adjustment.
Good job, buddy.
So first adjustment, I did the cranial work, and I worked on his lower back.
Okay.
Now the lower back nerves go to the colon, so
Okay.
you might notice more activity
Okay.
with that.
That's not anything we have a problem with.
That's good.
There.
That's good. The most common thing that moms notice after an adjustment, especially at this age, is that they do sleep longer.
Okay.
Their body is healing when they sleep, so if their body recognizes they're still going to be done, they sleep longer.